Latin music fills the small operating room at Yager Esthetics in Washington Heights. The music serves two purposes. It relaxes plastic surgeon Dr. Jeffrey Yager, a fluent Spanish speaker, as he performs liposuction on an elderly woman. It also pays homage to the largely Dominican population that Dr. Yager has catered to since 1997.
I think I'm become the go-to person in the Hispanic community because I get the results that they're looking for. I'm the curve doctor, I guess.
Those results, buttock enlargements and fat reduction, provide a glimpse into the aspirations and insecurities of the city's ethnic communities. According to the American Society of Plastic Surgeons, in the last 10 years in the United States, plastic surgery has doubled in the Asian population and tripled among Latinos. And niche markets have sprouted among New York's immigrant groups. They can now find surgeons who speak their language and perform operations that are tailored to their cultural preferences. So in Flushing's Asian community, doctors say patients line up for eyelid surgery. Breast enhancements are popular procedures among Russians in Brooklyn. And in Washington Heights, the Latin beauty ideal involves lots of curves.
Sin curvas, oh Dios mío, pero no sé qué decirte con relación a una persona que sea así, tipo caja. My God, necesita buscar a Yager.
2.5 years ago, Italia Viniero did just that. She wasn't happy with her flat chest and decided to get the kind of breasts that would fill out a bikini.
Mi personalidad no iba con los senos pequeños. O sea, para nosotros los dominicanos, tener unos buenos senos y una bonita cintura es algo muy importante. O sea, las latinas nos definimos por el cuerpo. O sea, siempre tenemos que la curvita, que si los cenitos, que si la nalguita. Entonces, prácticamente nos gusta que se vea mucho la silueta de la mujer.
That's where plastic surgeons like Dr. Yager come in.
Creating of curves, I would say, is 80% of what I do. In the ethnic populations, you want to make sure that, your beauty ideal and this doctor's beauty ideal are the same. But the key for me is to make them believable curves. You don't want to create cartoon characters. You want to create normal, believable curves that are within the ideal of the Hispanic community.
Even now, Dr. Yager says there are just some surgeries that this population isn't interested in.
I don't get a lot of patients who come from liposuction of the buttocks to reduce them. I've done that 3 times in my practice here.
But plastic surgery can be expensive and is not typically covered by health insurance. Dr. Yager offers payment plans and tries to keep his prices affordable. Still, some decide to go abroad to get surgery on the cheap, like this woman. On a recent morning, Dr. Yager saw a patient who had liposuction of her arms and breast implants in the Dominican Republic. She wasn't happy with the results.
Patients would go overseas because they said that American doctors don't understand how to make a Latin body.
But Ms. Viniero says it's becoming easier and easier to create the kind of body you want without leaving the city.
La mayoría de las personas que viajan a la República, primero porque mucha gente no sabe que hay médicos aquí que hablan español y saben muy bien cómo le gusta a la latina verse.